Welcome to Baden Street Settlement, where we have so much to offer.
Here at Baden Street, we have early pre-K.
And we have a top-notch child development center that serves children 6 weeks to 12 years old.
También tenemos comida y ropas para apoyarte en una emergencia.
At Baden Street Settlement, we also have food and clothing for an emergency.
Nuestro programa de salud dirigido a la conducta humana ofrece servicios para personas adultas con alguna discapacidad en el desarrollo o enfermedades mentales, incluyendo el apoyo para establecer metas y servicios.
Our Digital Arts Center has the technology to improve your learning and make your life easier.
Did you know that we have programs especially for teens?
Si tienes 18 años o más, tenemos un programa excelente contra el abuso de sustancias controladas.
If you are 18 and over, we have an excellent clinical guidance program.
Yeah, I'm a Baden Street. I love Baden Street.
Hi, I'm Mike Marsh. This is the Baden Street Settlement Monthly Town Talk. This is your chance to connect with what's going on at Baden Street. Come on in, let's talk. Hi everybody, let's talk. We do have a Spanish translation option available for you today, and we'll tell you a little bit more about that now.
Hola a todos. Ahora enseguida les comunico más sobre lo que vamos a poder charlar el día de hoy, pero queríamos informarles que hay interpretación simultánea disponible.
Okay. Well, welcome to our Town Talk this month. Our Town Talk this month is going to feature our M.A.R.C Center, our Mature Adult Resource Center. And we're going to tell you all about that. But I can't tell you how pleased we are to have as our keynote speaker tonight, M.A.R.C Cook, who is the CEO of Lifespan, which is the preeminent elder care advocacy agency in our area. We're also going to have a video of what our M.A.R.C does. And we're also going to have a discussion of our telehealth hub, which we will be opening soon. And as always, we'll have our town talent segment featuring Bernice Sheffield from the M.A.R.C and Bryan Gabriel. And then I'll talk a little bit about the Baden block party, which we're going to have on August 21st from 1 to 4 p.m. But first, I'd like to introduce our keynote speaker, and that's M.A.R.C Cook. M.A.R.C is the president and CEO of Lifespan of Greater Rochester. She's been a contributing member of Lifespan for over 25 years. She's the chair of the Monroe City Council for Elders and co-chair of the New York State Coalition on Elder Abuse Advisory Committee. She currently serves on the Council of Agency Executives, the Highland Hospital Board, Live On New York, Regional Health Information Organization, U of R Home Care, the Al Siegel Community of Agencies, and she's on Senator Gillibrand's working group on the aging. I can't tell you how happy we are to have M.A.R.C here to talk to us and to really keynote our session on the M.A.R.C and talk a little bit about our seniors in Monroe County. So M.A.R.C, welcome. Thank you so much for coming.
Mike, I can't thank you enough, and all of the folks at Baden for inviting me here today to talk about aging, to talk about the importance of the M.A.R.C Center at Baden, and really to talk about how we can all work together to help older adults in our community. If you don't mind, I just want to share my screen here with everyone. And let me just want to make sure folks can see that screen before I get going. Sounds like we're okay. So, like I said, I want to thank everybody at Baden for welcoming me to this town talk. And just to start out for a minute, just to let folks know about Lifespan, we're a nonprofit organization like Baden, and we help older adults take on both the challenges and opportunities of longer life. We have about 30 services under our roof, everything from our senior centers to general social work, elder abuse prevention, financial services, and we serve about 40,000 people a year from Rochester down to the Pennsylvania border, and a couple statewide programs I'll tell you about too. But today I really want to focus on the changing demographics, which I don't think we talk enough about, poverty in older adults. Certainly more about Lifespan services, definitely about the M.A.R.C at Baden, and then the integration of our services. So I think we can all work better together to make sure people receive the services they need. But if you don't mind, I'm going to start at the beginning, the very beginning. And in the beginning, there were only young people. So I want to talk about the demographics. And for most of human history, the average life expectancy was only 18 years of age. But by 1900, it was 47 years of age, the life expectancy, but retirement as we know it today didn't even exist just over 100 years ago. And we have grown decades worth of life in the last 100 years. So think about it. It was 47 in 1900, and today it's over 80. So 4 decades worth of life in over 100 years. But it really wasn't until the baby boomers hit, those individuals who were born from 1946 to 1964, that really transformed not only life as we know it, but certainly transforming aging. If you don't mind, let me just show you what happened once the boomers hit. It's really, we're in the midst of a historic age wave. When around 1900, there were about 3 million people 65 plus. Today, we're broaching 80 million people. We barely kept records about the 85 plus population until 1980. Think about that. And today, it's the fastest growing segment of the population. But here is really startling. So if you look at it, aging baby boomers, those born between 1950 and 1960, look what happened on this graph in yellow. The under 14 population, those boomers, increased the growth rate of 37%. 1960 to 1970, look at the 15 to 24-year-olds, and you see where I'm going with this, I'm sure. 1970 to 1980, the 25 to 34-year-old, the growth population spiked. 1990 to 2000, and here we are today. The fastest growing segment of the population, by far, the older adult population. And you can see the other segments of the population either shrinking or barely growing at all. So this is not only happening here in our community, but across the world. And I think it has major implications, major changes we need to do to help older adults with services in the future. And I just want to put this on for Monroe County because the same thing is happening in our community as is happening all throughout the world. So when you think about it, in 1970, there were about 96,000 older adults, 60 plus years of age. Today, this graph ends at 2016. There's about 166,000. It's just continuously growing, unlike other segments of the population. And I always say 2015, the year 2015 was a tipping point year in New York State. It was the first time ever that the 60 plus population was over 20%. And as you saw from the other graphs, will continue to increase year after year after year. And by 2030, so really just 9 years away, we'll look more like Florida did 10 years ago. Let me tell you a few facts, some sobering about our community, but some facts to sort of lay the groundwork too. Only about 4% of older adults reside in a nursing home. So you can see the vast majority of older adults are in the community with us. About 80% of long-term care is provided by families, not the formal system. And when you look at certain populations, Black and African American and Latino, that's more. I mean, culturally, they just take care of their own more. So that number increases even further, and the strain and stress on family caregivers is more and greater. And while most older adults live in the suburbs, there has been a huge increase in the older adult population in the last 10 years. So much so, quite frankly, that there's a lot of articles being written about what is going on in Rochester. And I'm going to talk a little bit about that. And then this is a stat I always look at, that older adults outlive their ability to drive by 7 to 10 years. So think of older folks that you know. How do they get to doctor's appointments? How do they get to Wegmans or the grocery store? How do they get to places where they need to go? And did we set up the right transportation systems for them to be able to still move throughout the community? I would say not yet anyway. Let me focus for a minute on the city of Rochester, because this is really where the articles are being written that I read about aging all the time. Think about this. In the last 10 years, there was a 36% increase in the older adult population in the city of Rochester. We rarely talk about it, do we? I'm really saying this to Mike Marsh because I want him to help me in the future talk about some of these stats. We have the highest rate of increase of any major city in the state, despite the fact that there was a 2% decrease in the overall population during the same period of time. For Rochester, we have a very diverse older adult population in the city of Rochester, with about 46% being non-white, so wonderful diverse population. But this is where it gets sobering. We have the highest rate of poverty in the older adult population at 31%, and the number of older adults in poverty in the last 10 years increased by 38%. So very startling, very troubling, very concerning, is we're trying to figure out how do we support older adults in our community when we know from other stats the vast majority live in the community. Let me tell you something about lifespan. I mean, one thing is we are going to issue a poverty report about older adults, and we're celebrating our 50th anniversary. We actually predated all the county offices for aging. I think I said earlier, we serve over 40,000 people a year in various programs, have a staff of about 160. I think it's a little more than that now. And most of our work is in a 10-county area, but we do 2 different programs statewide: elder abuse prevention, financial exploitation and scams, and we operate the New York State Caregiving and Respite Coalition. And on the right side of the screen, you'll just see some of our programs. I'll run through them quickly. New York Connects, which is a phone line or email where you can just ask a question. If you just want to know, you know, if your loved one's in the hospital and you want to understand discharge plans, if you want to understand home care, how do you get connected to the M.A.R.C at Baden, you can call that line and they can help you. We also have social workers in our Elder Source Care Management program that'll go to people's homes, help them understand benefits and link them to those benefits. I'll talk more about elder abuse prevention in a minute, but we also have mediation services, helping families who might have different views about their loved ones aging, help them work through those issues. We also help folks with geriatric addiction issues. Typically, it's people who are addicted to alcohol and prescription drugs, but we see street drugs. We have a caregiver institute to help family caregivers, in particular those who have a loved one with dementia, how to set care plans, get support in there, transportation, and of course our senior centers. And this is just naming a few of the 30 programs. Most of the time people call us for the items listed here, or care coordination or healthcare navigation, helping them with appointments or transportation, elder abuse, linking to home care or finding affordable housing, which is always an issue. And certainly we get a fair amount of calls about Medicaid, Medicare, just general advocacy, and of course, linking to legal services, oftentimes evictions, prevention. But let me focus, if you don't mind, on a few of our cornerstone programs. And I would say our first one is elder abuse prevention. We know a few awful facts. 300,000 older New Yorkers will be abused this year. Only 1 in 24 cases will ever be reported to anybody, whether it's lifespan, law enforcement, anybody at all. So it's really a hidden problem. We need to talk about it. And financial exploitation is one of the most common forms of abuse. And I know Baden Street would agree with me. We just believe it shouldn't hurt to be old, and older adults should not be taken advantage of. And honestly, the cost of financial exploitation in New York State each year is $1.5 billion a year. I just want to say it because I can barely see all the numbers. $1.5 billion a year, people are scammed out of money in various ways: grandparent scams, romance scams, family members. It's terrible. What we really saw this year was a huge increase in scams. People being taken advantage of during COVID, whether in the beginning it was to get a COVID test, just pay here. Of course, we all know they were free, all the way to the vaccines, same thing. I remember a call I personally took of a woman who was at the Dome Arena, and she had paid to get an appointment. Of course, she didn't have one early on when the vaccines were being given, and scammed out of that money to get that vaccine. And it's been happening all throughout our community. Our response at Lifespan, we created the Upstate Elder Abuse Center to help intervene in these situations. We do a lot of education and awareness, and we created multidisciplinary teams throughout New York State. Teams that work together, medical community, Lifespan social workers, the DA's office or law enforcement when appropriate, but really trying to make sure the older adult is safe, the abuse is stopped, and if appropriate, bringing those who abuse someone to justice. Second sort of major issue I want to talk about today is social isolation. And certainly we saw this throughout the pandemic, but we knew it was a problem even before. And we also know that loneliness and social isolation not only leads to elder abuse, because it did, but really it's a public health hazard similar to obesity in how it attacks somebody's mind and somebody's physical health. Our kind of response to that, and I know also the M.A.R.C at Baden, is really bringing folks together for socialization, for fun, for support, for education, for work on health and wellness. And if you don't mind, I just want to show you a short video of something positive here after talking about abuse. It's really about the love of these two folks who met at our cafe at the Maplewood YMCA. Let me play it for you. It's a couple minutes long.
Met there and discovered they had things in common, including a love of music and dance. So they started going dancing, and the relationship blossomed into a romance.
I started using a coupon. I must save a couple of $100. My daughter says, "You got an answer
I'm sure you can see why now, why I wanted to show you that. And I think it's the importance of social connections at places like the Market Baden or the Lily Cafe at Lifespan. It really honestly creates this family atmosphere where people feel supported. And in addition to the love going on at the Lily Cafe, we also focus, of course, a lot on chronic disease self-care management, on diabetes workshops. And what we hear from folks is they say, this is great because I can do something to make myself feel better and work on my chronic conditions. So we do that a lot too. I also wanted to show a picture of Willie. Willie Murphy is a member at our Willie Cafe, and she's got everybody lifting weights. I don't even want to tell you how much she can lift. I think like 185 pounds, but she's got everyone focused on health and wellness too, similar to the Market Baden. But these places are invaluable for people to come in, make friends, and get connected to services. A few more folks from our staff, but I really want to switch gears once again to the implications of this longer life. What can we as a community do as we know people are living longer and hopefully healthier, or help them? I have to say during COVID, and since COVID really is beginning to wane, we still can see that folks are calling us every single day for food and access to health care. It's concerning to me that food isn't more readily available for older adults. And we know we need to do a push to help folks get on food stamps, SNAP, and get access to health care. Second thing we're trying to do is really, really connect people and stop this loneliness and isolation that forced people home during COVID. We're opening up our own senior center, which is the Wool Cafe downtown in the Sibley's building. I know the M.A.R.C is opening up, and really trying to get friends back together again. We see a huge increase in the need for home care and families delaying higher levels of care because of COVID. And there's a huge workforce shortage right now of trying to get home care workers into homes. So we're trying to figure out working, hopefully an increase in pay for those home care workers will help, but we know families need that support. We're also trying to help families with access to health care. Some of the telehealth isn't going to go away. What we saw in during COVID is we sent our social workers out with laptops and, broadband access, hotspots, so that people could just connect to their doctors, which was so needed. And we're trying to figure out, how do we get the conversation, not only the digital divide of children, but also there's a digital divide of older adults who need that kind of access. We know that the pandemic put an enormous amount of stress on families as families were trying to care for children as well as their aging parent. And really there's a fatigue from this pandemic. So trying to figure out how do we support those family caregivers, all while, we always face funding cuts after these kind of events. So, I think change can happen. It can happen a different way. There's many of us working on sort of a systems integration. How do we integrate? So if someone walks into the Market Baden, and Baden may not do the services they need, they can easily connect to those that do, or vice versa. Walk into Lifespan, but they need the Market Baden. How do we do that easier for people? I think we need to simplify our services and make funding more accessible and technology more accessible to people. And of course, I'm looking forward to working closer with the M.A.R.C. because I know the importance of the M.A.R.C. and really continuing to emphasize health and wellness strategies so people can feel more control of their own health care. We're also trying to figure out at Lifespan how to measure health span. A lot of people measure longevity, how long people are going to live, but how do we measure how healthy they are for as long as they live? And of course, we're looking at reimagining long-term care. As families want to take care of their loved one more at home, for longer, how do we provide them the supports that they need? And of course, what we really want to do, and I really want to do this with Baden, is how do we make Rochester a great place to age well, or maybe better, the best place to age well, because we're looking at data, we're talking to folks and listening to what they need, and we're really working together. We're working together for everybody in our community. Thank you. And Mike, I guess I turn this back over to you.
Anne-Marie, thank you so much. That presentation is eye-opening. We've kind of given a smaller version of it to me before. So, and I think I know the answer to this question, but how can we help government recognition of the numbers and statistics you showed us, and therefore government assistance? How can we help that be focused on our aging, mushrooming aging population?
Yeah, Mike, I would like to see older, we can set up different events, and so that legislators and leaders can talk to older adults themselves, so that they can hear the struggles that they are experiencing, trying to access food or trying to access healthcare. And I would love to work with you on that, because I think there's no better voice than the voice of the older adult explaining how they have helped our community for years and how they need support now. And they deserve it, and we need to give it to them.
Absolutely. And thank you for everything you've talked about, everything that Lifespan does. Does Lifespan have Spanish speaking staff?
Yes, we do. And we have several Spanish speaking staff, but we also have other languages too. We also have staff who speak Russian, Italian, and there's another language there. But anyway, we have 5 or 6 people on the phones who can speak Spanish.
So I know you and I are on a couple of task force, and one thing I'd like you to talk about maybe is the importance not just of our aging population being vaccinated against COVID, but everyone being vaccinated against COVID.
Yeah, I mean, you can see it, Mike, in the data that the vaccines work, and that's what we were all looking for, wasn't it? So now I was honestly just on a call before this with one of our hospital systems, and there are some people in the hospital with COVID, all of them unvaccinated people. And we can see the numbers too of who's getting the COVID right now. It is the unvaccinated folks. So I think we have a lot of data to suggest that this vaccine works. We're all worried, I think, right now about the new variant that's out now, extremely contagious, and honestly, people get very sick with it. So we're trying to encourage people. We'll help you with appointments. We'll provide transportation for you to get the vaccine, whatever it takes. But clearly the data shows that it works, and we want to protect every community and every person in Monroe County and Rochester so that no one gets sick.
Emery, again, I can't tell you how much we appreciate you taking the time to speak with us. This is a fantastic presentation. And if people want to reach Lifespan, look up your website. Is there a phone number they should call?
Absolutely. It's 244-8400. It's 244-8400.
Anne-Marie, thank you. Thank you again. We really appreciate it.
Well, thank you so much, Mike. I look forward to working with all the folks at Baden.
Oh, same here. That was a fantastic presentation. And during the presentation, Anne-Marie talked about our M.A.R.C Center several times. And so I thought what we do is play a little video of the M.A.R.C Center and also some of our participants in the M.A.R.C Center. And then we'll have a Q&A with Ms. Dolores Rodriguez, who helps to coordinate our M.A.R.C Center.
Bernice, Sheffield,
What program do you partake in?
the Baden Street program.
And you attend our senior citizen program, is that correct?
Yes,
And what is it that you like about our program?
I like meeting the people and playing games and, singing and just going on, if we get to go on a trip, that's very exciting. It gives us something to do. It's very exciting.
How long have you been attending?
Oh, see, I think about 4 years, somewhere in that area. I've been there a while, so. I had brought a couple other people with me, but the couple of them done passed, so, it's been definitely been a while.
What has been your favorite part of the program?
Just being able to gather with the other seniors and talk to them and see how they're doing and helping them in any way that I can.
My name is Celia Fernandez. And I come to the program because, I enjoy the program. I like my friends in the program, and I don't want to be home, all day by myself. Sometimes, I got some paper that I don't know how to do it. And, I be there in the program about 40 years.
Y lo más que usted, ¿cómo se dice? Le gusta de la programa. ¿Cuál es lo más?
Well, I like the program because they take us, sometimes to the movie. They take us, to the casino, that I love casino. And sometimes, she take us, to the factory that they do the glasses. I love that too. And we like, I don't like to fish, but I go there and, and I cook for the people that they fish,
Thank you.
So Ms. Dolores, those are some great videos of the M.A.R.C. And I actually, first I should say, I'm very pleased to have with us Dolores Rodriguez. She's our Director of Emergency and Family Assistance and also our M.A.R.C program. And Ms. D, I would love for you to talk about the M.A.R.C Center. Tell me a little bit about it.
The M.A.R.C Center. The M.A.R.C Center is for our seniors 60 and over. They come and participate 4 days out of the week as we reopen, because we are reopening, and everyone is excited to participate. They're going to be coming 4 days out of the week where they're going to be served a hot meal. They get to interact with their friends again.
Excellent. Are there specific types of things that they do? That they go on trips? What are some of the things that you do as part of the M.A.R.C Center?
Yes, they go on shopping sprees, they play billiards, they play card games, they play board games, they play bingo, they go to the museums, Museum of Glass. The year before COVID, we went on a boat ride and took a tour Genesee River and Erie County River.
Now in M.A.R.C's video, there was a lot of romance in there. Do you guarantee romance as part of the M.A.R.C Center?
I can't guarantee, but I know they will interact and socialize as much as they can once they come back.
So if I want to participate in the M.A.R.C Center, how do I do that?
You contact us at Baden Street Settlement at 325-4910 and ask for the M.A.R.C program, and they will direct your call to Lois.
And do we provide things like transportation? Suppose somebody is kind of homebound,
yes,
can't drive anymore, as Anne-Marie talked about. Do we provide transportation?
Yes, we do, through Medical Motors. Also, some of the seniors have their own transportation where they carpool.
Awesome.
Yes. Awesome.
That just sounds like a great program.
It is. I intend to partake in it as well once I get there.
Yeah, I'm already there, and you may catch me over there. Ms. D, thank you very much. We appreciate it.
Thank you.
And so one of the things that Anne-Marie talked about is telehealth, and how, especially during COVID, one of the things that our seniors had to do was communicate with their primary care physicians, and were unable to do so because they didn't have access to broadband. As we know, that's a problem in our neighborhood, or didn't have the right equipment. And so we actually, Lee Harris had the idea of starting a telehealth hub for Baden. So I'd like to show you a little video of our telehealth hub that will be opening very shortly. And then we'll have a question and answer with Lee about the telehealth hub, because I think this is a service that will appeal to everyone, but specifically our senior population, who really sometimes need somebody to help guide them through communication with their physicians, especially in the age of things like COVID. So let's watch that video. So Lee, welcome. You're usually behind the camera for these town talk sessions.
Yeah, unless you have me singing, but yes.
Yeah, that's true. You were a town talent participant too. Thank you for that.
Oh, no problem.
So, one thing is that you during COVID, we knew that our community was struggling with how to communicate with their primary care physicians, and you talked about the idea of having a telehealth hub. What is the telehealth hub?
Well, the Telehealth Hub is a way for any individual, primarily seniors, because being out in the community myself, I go to people's houses and I see they have equipment they don't know how to utilize, or they don't have the resources. So with the Telehealth Hub, we have the resources, we have individuals who can help you, and it's just a benefit for the community.
Okay. And tell me what, we saw a little bit about what the room looks like. What sort of equipment is there in the room?
We have a camera that tracks you. So if you have to do anything interactive with the doctor, he might want you to put your hands up or something, stand up, it'll track you. We have a blood pressure cuff, a digital scale that takes your BMI. It's very intuitive. It takes too much, honestly. We have a stethoscope that's digital, because the information is important for the doctor. So we have technology that we can give the doctor the information without actually being doctors ourselves.
Now, there's no medical personnel at the Telehealth Hub. I want to let people know that, but we will have someone there to assist them on kind of the basics of using the equipment.
Yes, we will have somebody who has the knowledge to run the equipment, to help individuals with emails if they don't have an email, how to reach out to the doctor if they don't know how to work Zoom. The attendant will help them.
Okay. Well, Lee, I want to thank you, not just for the idea, but for all you did to help execute this. And we're going to be open soon. About when do we think we'll be open?
I'm thinking probably mid-month of next month. But I gotta thank you also, because when I came to you with this idea, you really went with it and made it happen. So I appreciate that myself.
Thank you, Lee. So one thing I do want to say is that this Telehealth Hub is becoming a reality with the assistance of Excelis Foundation, the Rochester Community Foundation, and the ESL Foundation. They provided some needed funds to help us make this reality.
Thank you, sponsors.
And so with that, I'd like to introduce the Town Talent segment, and it's going to feature Ms. Bernice Sheffield, who we saw in the video earlier. And it's also going to feature Bryan Gabriel, who's going to be playing a little Scott Joplin. So let's introduce the Town Talent.
In times like these, we need a savior. In times like these, we need an anchor. So you be sure, in your heart be sure, that your anchor holds and grips a solid rock. This rock is Jesus. He's the one. This rock is Jesus. The only one. So you be sure, in your heart be sure that your anchor holds and grips a solid rock. Okay.
Very nice town talent segment there. And so before I close, I wanted to also talk a little bit about the Baden Block Party. That's going to be August 21st from 1 to 4 p.m. It's going to be in the Baden Street parking lot at 152. You know, Baden Street has historically done a gala, and because of COVID and some other things, we didn't really have, have the wherewithal to plan a gala. So we thought, what better way to bring our community together than to have a block party at 152 Baden. It's a place where everybody knows, and it's going to be a great time. So we like it. We'll talk more about it in next month's Town Talk as well. But I'd like you to save the date, August 21st from 1 to 4 p.m. And we look forward to seeing our community there. So I want to thank everyone for joining us. As you know, I always end with talking about the programs we have at Baden. You know, all know our community youth and adult development programs that Ms. Quick talked about last month, our Child Development Center, our Behavioral Health and Community Service, our Counseling and Support Center, helping people with chemical dependency, our Metro Council for Teen Potential, and as we talked about tonight, our M.A.R.C Center. We can't wait for that to get started again. Our Digital Arts Center, which will be featured in next month's Town Talk, and our Emergency and Family Assistance Group. And as you know, please look at our website at www.badenstreet.org. We take a lot of time to keep that up and keep it current with everything that's going on at Baden. Next month, as I said, we'll talk about our digital arts programs, and it will feature our very own Davis Craig as our keynote speaker. And as I always like to close this to say, please get the vaccine. Thanks to everyone who's gotten the vaccine. But we hope that everybody can. We sponsored a clinic at Baden Street last week. It was fairly well attended, but there are a number of places you can get it. Don't just get it for yourself, but get it for those in your family. And I'd like to thank M.A.R.C for the fantastic presentation, for kind of educating us on our aging population and giving us some things that we can do to advocate for that population. I'd like to thank Emma. Welcome to the team, Emma, for your help. As always, Lee, Davis, and Cameron. I'd like to thank Ms. Burrows, who helped us kind of in the background. And of course, Ms. Rodriguez for participating in the Town Talk and telling us all about the M.A.R.C Center. So thanks to everyone, and we'll see you next month.